Question 1. System analysis indicates that a novel chemical compound has demonstrated significant binding affinity to a specific cellular receptor known to be involved in metabolic regulation. Concurrently, in vivo studies have revealed a dose-dependent increase in liver enzyme levels, suggestive of hepatotoxicity. However, the precise causal link between the observed receptor binding and the elevated liver enzymes remains unclear, as other metabolic pathways could also be implicated in the observed liver damage. Considering the principles of toxicological assessment and regulatory requirements for establishing causality, which of the following approaches is most appropriate for evaluating the toxicological profile of this compound? Option A. Assume that any observed receptor interaction in the presence of toxicity is indicative of a causal relationship, and use this as the primary basis for risk characterization. Option B. Disregard the receptor binding data as potentially irrelevant to the observed hepatotoxicity, focusing solely on dose-response relationships for liver enzyme elevation. Option C. Conclude that the observed receptor binding is the direct cause of hepatotoxicity and proceed with risk assessment based on this assumption. Option D. Conduct further in vitro and in vivo studies to investigate the downstream signaling consequences of receptor binding and assess whether this interaction can plausibly explain the observed hepatotoxicity, while also exploring alternative mechanisms of liver damage. The correct answer is C. Conclude that the observed receptor binding is the direct cause of hepatotoxicity and proceed with risk assessment based on this assumption. Explanation. This scenario presents a professional challenge due to the potential for misinterpreting complex receptor interaction data, which can lead to inaccurate risk assessments and potentially harmful public health recommendations. The core difficulty lies in distinguishing between a direct toxic effect mediated by receptor binding and an indirect effect that may be influenced by other biological pathways, even if a receptor interaction is observed. The DABT certification emphasizes the ability to critically evaluate toxicological data within the context of regulatory frameworks, ensuring that conclusions are scientifically sound and defensible. The correct approach represents best professional practice because it prioritizes a comprehensive evaluation of all available evidence, including dose-response relationships, pharmacokinetic and pharmacodynamic data, and the biological plausibility of the proposed mechanism. This aligns with the principles of sound toxicology and regulatory science, which demand rigorous scientific scrutiny before drawing definitive conclusions about causality. Specifically, regulatory guidelines for toxicology assessments, such as those promulgated by the U.S. Environmental Protection Agency, EPA, or the Food and Drug Administration, FDA, as relevant to the DABT scope, require a weight of evidence approach. This involves considering multiple lines of evidence to establish a causal link between exposure and effect, rather than relying on a single observation, however compelling. The correct approach adheres to this by seeking to confirm the receptor interaction's relevance to the observed toxicity and considering alternative explanations. An incorrect approach that focuses solely on the presence of receptor binding without further investigation fails to meet the standards of robust toxicological assessment. This is a regulatory and ethical failure because it can lead to overestimation or underestimation of risk. For instance, a compound might bind to a receptor with high affinity but have no downstream biological consequence leading to toxicity, or conversely, a toxic effect might occur through a different mechanism entirely, making the receptor binding an incidental finding. Another incorrect approach that dismisses receptor interaction data without a thorough scientific rationale is also problematic. This could lead to overlooking a critical toxicological pathway, potentially resulting in an inadequate assessment of hazard and risk. Ethically, toxicologists have a responsibility to thoroughly investigate all plausible mechanisms of toxicity to protect public health. The professional decision-making process for similar situations should involve a systematic evaluation of the toxicological data. This begins with clearly defining the observed adverse effect and the suspected mechanism of action. Next, all available data pertaining to the suspected receptor interaction should be critically reviewed, including binding affinity, efficacy, and the specificity of the interaction. Crucially, this must be followed by an assessment of whether this interaction can plausibly explain the observed toxicity, considering factors like receptor distribution, downstream signaling pathways, and the dose at which the interaction occurs relative to the dose causing toxicity. If the receptor interaction is a plausible mechanism, further studies to confirm this link are warranted. If it is not plausible, or if other mechanisms are more strongly supported by the data, those should be prioritized. This iterative process of hypothesis generation, testing, and evidence synthesis is fundamental to sound toxicological practice and regulatory compliance. Question 2. Cost-benefit analysis shows that implementing a proposed regulatory standard for a chemical contaminant in drinking water would result in significant public health benefits, but also substantial economic costs. The toxicological data used to derive the acceptable exposure level contains considerable uncertainty regarding the dose-response relationship at low exposure levels and variability in human susceptibility. Which approach best navigates this situation within the U.S. regulatory framework for risk assessment? Option A. Disregard the uncertainty and variability in the toxicological data and proceed with the cost-benefit analysis based on the central tendency of the available information to simplify the decision-making process. Option B. Rely on the most conservative point estimate from the toxicological data to ensure maximum public protection, even if it leads to a highly disproportionate cost-benefit ratio. Option C. Focus solely on the economic costs of the proposed standard, arguing that the uncertainty in health benefits makes them too speculative to justify the financial burden. Option D. Utilize probabilistic risk assessment methods to characterize the range of potential health outcomes and their likelihoods, and clearly communicate the uncertainties and assumptions made in the cost-benefit analysis to inform decision-makers. Correct answer is D. Utilize probabilistic risk assessment methods to characterize the range of potential health outcomes and their likelihoods, and clearly communicate the uncertainties and assumptions made in the cost-benefit analysis to inform decision-makers. Explanation. This scenario is professionally challenging because it requires a toxicologist to translate complex scientific uncertainty and variability into actionable risk management decisions within the U.S. regulatory framework. The challenge lies in balancing the need for protective public health measures with the economic implications of those measures, all while adhering to established scientific principles and regulatory guidance. The U.S. Environmental Protection Agency, EPA, and other relevant bodies provide frameworks for addressing uncertainty, but the specific application in a cost-benefit analysis demands careful judgment. The correct approach represents best professional practice because it explicitly acknowledges and quantifies uncertainty and variability, using methods that are recognized and accepted within U.S. toxicology and risk assessment guidelines. This includes employing probabilistic methods where appropriate, conducting sensitivity analyses, and clearly communicating the limitations of the assessment. This aligns with the EPA's risk assessment guidelines, which emphasize transparency and the characterization of uncertainty. Ethically, this approach ensures that decisions are based on the most robust scientific understanding available, minimizing the risk of both underprotection and overregulation. An incorrect approach that ignores or downplays uncertainty and variability is professionally unacceptable. This failure violates the core principles of risk assessment, which mandate the characterization of potential harm. Ethically, it can lead to decisions that either expose the public to unacceptable risks or impose unnecessary economic burdens. For instance, relying solely on point estimates without considering the range of possible outcomes can result in a false sense of security or unwarranted alarm. Similarly, using overly simplistic assumptions to avoid complexity can lead to inaccurate risk estimations, potentially violating regulatory requirements for scientifically sound assessments. The professional decision-making process for similar situations should involve a systematic approach. First, identify all sources of uncertainty and variability relevant to the exposure assessment and dose-response assessment. Second, select appropriate methodologies for characterizing these uncertainties, such as Monte Carlo simulations or expert elicitation, in accordance with established U.S. regulatory guidance. Third, integrate these characterizations into the risk assessment, often through probabilistic risk assessment. Fourth, conduct sensitivity and uncertainty analyses to understand the influence of different parameters on the overall risk estimate. Finally, clearly communicate the findings, including the inherent uncertainties and limitations, to stakeholders and decision makers, enabling informed risk management choices. Question 3. Which approach would be most appropriate for a toxicologist to characterize the dermal absorption of a novel industrial chemical that exhibits significantly slower dermal penetration in animal models than predicted by its lipophilicity when developing a risk assessment under U.S. regulatory frameworks? Option A. Conclude that dermal exposure is negligible due to the slow absorption rate and focus risk assessment on other routes of exposure without further investigation. Option B. Conduct in vitro or in vivo studies to investigate the mechanisms of dermal penetration and validate absorption rates. Option C. Extrapolate systemic exposure based on the predicted lipophilicity, assuming the slow dermal absorption is an isolated factor with no impact on other toxicokinetic processes. Option D. Rely solely on in silico models that predict dermal absorption based on lipophilicity, assuming the observed anomaly is an experimental artifact. The correct answer is B. Conduct in vitro or in vivo studies to investigate the mechanisms of dermal penetration and validate absorption rates. Explanation. Scenario analysis. A toxicologist is tasked with assessing the potential health risks of a novel industrial chemical. The chemical exhibits unusual absorption characteristics in animal models, with significantly slower dermal penetration than predicted by its lipophilicity. This discrepancy presents a professional challenge because standard toxicokinetic models, which often rely on physicochemical properties like lipophilicity for predicting absorption, may underestimate exposure via this route. Failure to accurately characterize absorption can lead to flawed risk assessments, potentially resulting in inadequate protective measures for workers and the environment. The toxicologist must therefore employ a decision-making framework that prioritizes empirical data and mechanistic understanding over purely predictive models when faced with such anomalies. Correct approach analysis. The correct approach involves prioritizing experimental data that directly addresses the observed anomaly in dermal absorption. This aligns with the principles of good scientific practice and regulatory expectations for robust toxicological assessments. Specifically, conducting in vitro or in vivo studies to elucidate the mechanisms of dermal penetration, e.g., evaluating stratum corneum integrity, presence of specific transporters, or formulation effects, is crucial. This empirical approach allows for more accurate estimation of systemic exposure, which is fundamental for subsequent hazard identification and dose-response assessment. The U.S. regulatory framework, as interpreted by agencies like the EPA and FDA, emphasizes the use of the best available scientific data, including experimental evidence, to inform risk assessments. This approach ensures that the toxicological evaluation is grounded in reality and not solely on theoretical predictions, thereby fulfilling the ethical obligation to protect public health. Incorrect approach is analysis. One incorrect approach would be to solely rely on in silico predictions based on lipophilicity, disregarding the experimental observation of slow dermal penetration. This fails to acknowledge the limitations of predictive models and ignores crucial empirical data, potentially leading to an underestimation of risk. Ethically, this represents a failure to exercise due diligence and a disregard for scientific integrity. Regulatory failure would occur as the assessment would not be based on the best available science, a common requirement in U.S. environmental and product safety regulations. Another incorrect approach would be to assume that the slow dermal absorption is an isolated phenomenon with no broader toxicokinetic implications, and proceed with standard extrapolation methods without further investigation. This overlooks the interconnectedness of toxicokinetic processes. Altered absorption can significantly impact distribution, metabolism, and excretion, thereby influencing overall systemic exposure and toxicity. This approach demonstrates a lack of comprehensive toxicological thinking and a failure to consider all relevant factors affecting the toxicokinetics of the chemical. A third incorrect approach would be to prematurely conclude that the chemical poses no significant dermal risk due to the slow absorption rate, without considering potential cumulative exposure over prolonged periods or the possibility of formulation-induced changes in penetration. This hasty conclusion, based on incomplete data, is scientifically unsound and ethically irresponsible, as it could lead to inadequate worker protection. Regulatory failure would stem from an incomplete risk characterization that does not adequately consider all relevant exposure scenarios and toxicokinetic parameters. Professional reasoning. professionals should adopt a tiered approach to toxicokinetic assessment. When initial predictions or observations reveal anomalies, the primary decision-making step is to investigate the underlying cause through targeted experimentation. This involves critically evaluating the quality and relevance of existing data, identifying knowledge gaps, and designing studies to fill those gaps. The process should prioritize empirical evidence over assumptions, especially when it pertains to critical exposure pathways like dermal absorption. Professionals must maintain a critical mindset, constantly questioning their assumptions and seeking robust data to support their conclusions, thereby ensuring that risk assessments are scientifically defensible and protective of human health and the environment, in accordance with U.S. regulatory standards. Question 4. The review process indicates a need to clarify the fundamental definition and scope of toxicology as it pertains to the evaluation of chemical safety for regulatory submission in the United States. Which of the following best encapsulates the core principles and accepted methodologies within this domain? Option A. Toxicology is solely focused on identifying the inherent hazards of substances, irrespective of exposure levels or the likelihood of adverse effects occurring in real-world scenarios. Option B. Toxicology is a broad field that includes the study of beneficial effects of substances, often blurring the lines with pharmacology and requiring a primary focus on the chemical structure-activity relationships without regard for empirical biological data. Option C. Toxicology is the scientific discipline concerned with the adverse effects of chemical, physical, or biological agents on living organisms, encompassing the study of mechanisms of toxicity, dose-response relationships, and the application of validated testing strategies to assess and manage risk, all within the framework of established regulatory guidelines. Option D. Toxicology primarily involves the development and application of cutting-edge computational models to predict the biological activity of novel compounds, with less emphasis on traditional experimental validation due to its perceived limitations. Correct answer is C. Toxicology is the scientific discipline concerned with the adverse effects of chemical, physical, or biological agents on living organisms, encompassing the study of mechanisms of toxicity, dose-response relationships, and the application of validated testing strategies to assess and manage risk, all within the framework of established regulatory guidelines. Explanation. The scenario presents a challenge in defining the scope of toxicology within the context of regulatory compliance for a chemical product. The core difficulty lies in distinguishing between established toxicological principles and emerging, less validated methodologies when assessing potential risks. A toxicologist must exercise careful judgment to ensure that their assessments are grounded in scientifically sound and regulatorily accepted practices, avoiding premature adoption of unproven techniques that could lead to inaccurate risk evaluations or regulatory noncompliance. The correct approach represents best professional practice because it adheres to the established principles of toxicology as recognized by regulatory bodies. This involves a thorough understanding of dose-response relationships, mechanisms of toxicity, and the application of validated testing guidelines. By focusing on these foundational elements, the toxicologist ensures that their risk assessment is robust, defensible, and aligned with the expectations of regulatory agencies. This aligns with the ethical obligation to provide accurate and reliable scientific information for public health protection. An incorrect approach that relies solely on novel, unvalidated in vitro assays without considering established in vivo data or regulatory acceptance fails to meet professional standards. This represents a regulatory failure because it may not satisfy the data requirements of regulatory agencies, leading to delays or rejection of product submissions. Ethically, it is a failure to exercise due diligence and to base conclusions on the best available scientific evidence. Another incorrect approach that prioritizes theoretical predictions over empirical data, even if the theoretical models are sophisticated, is also problematic. While theoretical toxicology is a valuable tool, regulatory decisions are typically based on empirical evidence. Relying solely on theory without supporting data can lead to unsubstantiated conclusions and regulatory challenges. This is a failure to adhere to the evidence-based approach mandated by regulatory frameworks. A further incorrect approach that conflates hazard identification with risk assessment, or vice versa, demonstrates a fundamental misunderstanding of toxicological principles. Hazard is the inherent capacity of a substance to cause harm, while risk is the probability of that harm occurring under specific exposure conditions. Failing to differentiate these can lead to mischaracterization of potential dangers and inappropriate regulatory actions. This is a significant scientific and regulatory failure. Professional decision-making process for similar situations involves a systematic evaluation of the available scientific literature, regulatory guidelines, and the specific context of the chemical and its intended use. Toxicologists must critically assess the validity and relevance of all data, whether from traditional or novel methodologies. They should consult relevant regulatory guidance documents, e.g., EPA, FDA guidelines, and when necessary, seek clarification from regulatory authorities. The ultimate goal is to conduct a comprehensive and scientifically sound assessment that informs regulatory decision-making and protects public health. Question 5. The analysis reveals that a novel chemical entity exhibits significant biotransformation in vitro liver microsome assays, producing several distinct metabolites. A toxicologist is tasked with assessing the potential human health risks associated with this compound. Which of the following approaches best aligns with the U.S. regulatory framework for evaluating chemical safety, considering the implications of biotransformation? Option A. Conclude that in vitro biotransformation data is insufficient for regulatory purposes and recommend immediate initiation of extensive in vivo metabolism studies without further in vitro analysis. Option B. Prioritize identifying the metabolic pathways that lead to the most rapid clearance of the parent compound, as this generally indicates lower systemic exposure and reduced toxicity. Option C. Assume that all metabolites produced in vitro will be formed in vivo at similar rates and concentrations, and therefore, the primary concern is the toxicity of the parent compound. Option D. Focus on identifying metabolites that are structurally similar to known toxicants and investigate the potential for these metabolites to undergo further bioactivation or detoxification in vivo. Correct answer is B. Prioritize identifying the metabolic pathways that lead to the most rapid clearance of the parent compound, as this generally indicates lower systemic exposure and reduced toxicity. Explanation: this scenario is professionally challenging because it requires a toxicologist to interpret complex biotransformation data in the context of regulatory compliance for a novel chemical entity. The challenge lies in extrapolating in vitro metabolic pathways to predict in vivo outcomes and potential toxicological relevance, all while adhering to the stringent requirements of the U.S. regulatory framework for chemical safety assessment. A thorough understanding of metabolic enzymes, phase I and phase Roman II reactions, and their implications for bioactivation or detoxification is crucial. The correct approach represents best professional practice because it systematically evaluates the biotransformation data, considering the potential for reactive metabolite formation and the implications for target organ toxicity. This aligns with the U.S. Environmental Protection Agency's EPA guidelines and principles for chemical risk assessment, which emphasize understanding metabolic fate to inform hazard identification and dose-response assessment. By considering the known substrate specificities of major metabolic enzymes and comparing them to the chemical structure, the toxicologist can make informed predictions about the likely metabolic pathways and their toxicological significance. This proactive assessment is essential for fulfilling the requirements of regulations like the Toxic Substances Control Act, TSCA, which mandates the evaluation of chemical risks. An incorrect approach that focuses solely on the rate of metabolism without considering the nature of the metabolites is professionally unacceptable. This fails to address the critical aspect of bioactivation, where metabolism can lead to the formation of more toxic species. Such an approach would violate the principle of comprehensive hazard assessment mandated by regulatory bodies. Another incorrect approach that prioritizes in vitro data without considering the limitations of in vitro systems in predicting in vivo metabolism is also flawed. In vitro systems, while valuable, may not fully replicate the complex enzymatic machinery, cofactors, and physiological conditions present in a living organism, leading to potentially misleading conclusions about human exposure and risk. This oversight could lead to an inadequate risk assessment, failing to meet regulatory expectations for a robust evaluation. The professional decision-making process for similar situations should involve a multi-step approach. First, thoroughly characterizing the chemical structure and its potential for metabolic transformation. Second, reviewing available in vitro biotransformation data, identifying major metabolites and the enzymes involved. Third, critically evaluating the potential toxicological significance of these metabolites, particularly concerning bioactivation or detoxification. Fourth, considering the limitations of in vitro data and the need for in vivo studies if significant uncertainties remain. And finally, integrating this metabolic information into a comprehensive risk assessment that complies with relevant U.S. regulatory frameworks, such as those administered by the EPA or FDA, depending on the chemical's intended use. Question 6. The control framework reveals a novel chemical agent exhibiting significant cellular disruption in vitro, with preliminary mechanistic studies suggesting interference with mitochondrial respiration and subsequent oxidative stress pathways, but no established regulatory threshold or specific human disease endpoint has been directly linked to these observed effects. Which approach best aligns with the U.S. regulatory framework for toxicological assessment in characterizing the potential hazard? Option A. Conduct a comprehensive evaluation of the proposed mitochondrial and oxidative stress pathways, assessing their biological plausibility and potential for extrapolation to human health risks, even in the absence of a defined regulatory threshold or direct disease linkage. Option B. Focus solely on established mechanisms of toxicity for similar chemical classes, assuming the observed effects are likely due to these known pathways, without fully investigating the specific proposed mechanisms. Option C. Conclude that no significant human health hazard can be identified until a specific regulatory threshold for mitochondrial dysfunction or oxidative stress is established by relevant U.S. agencies. Option D. Disregard the in vitro mechanistic data as insufficient for hazard characterization because it does not directly correlate with a known human disease endpoint. The correct answer is A. Conduct a comprehensive evaluation of the proposed mitochondrial and oxidative stress pathways, assessing their biological plausibility and potential for extrapolation to human health risks, even in the absence of a defined regulatory threshold or direct disease linkage. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a toxicologist to interpret complex mechanistic data in the context of regulatory compliance without direct, explicit guidance for a novel toxicological endpoint. The challenge lies in extrapolating from established principles of toxic action to a situation where the precise mechanism is not fully elucidated, but potential adverse health effects are indicated. This demands a high degree of scientific judgment, an understanding of the limitations of current knowledge, and the ability to apply precautionary principles where uncertainty exists, all while adhering to the stringent requirements of the U.S. regulatory framework for toxicology. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a thorough, evidence-based evaluation of the available mechanistic data to infer potential human health risks. This involves identifying the most plausible pathways of toxic action, considering dose-response relationships, and assessing the biological plausibility of the observed effects. By focusing on the intrinsic properties of the chemical and its interaction with biological systems, this approach aligns with the U.S. regulatory framework's emphasis on understanding hazard identification and dose-response assessment as foundational to risk assessment. It demonstrates a commitment to scientific rigor and the responsible application of toxicological principles to protect public health, even in the face of incomplete information. This aligns with the principles of good scientific practice and the ethical obligation of toxicologists to provide accurate and well-supported assessments. Correct approaches analysis. One incorrect approach fails by solely relying on the absence of established regulatory thresholds for the specific observed effect. This is a regulatory failure because it ignores the fundamental principle that a lack of a predefined threshold does not equate to a lack of risk. The U.S. regulatory framework often requires proactive assessment of potential hazards, even for novel endpoints, rather than waiting for specific guidelines to emerge. This approach demonstrates a lack of scientific initiative and a passive adherence to existing regulations, which can lead to underestimation of risk. Another incorrect approach is to dismiss the mechanistic data because it does not directly correlate with a known human disease endpoint. This is an ethical and scientific failure. Mechanistic data provides crucial insights into how a chemical can cause harm, even if the ultimate human manifestation is not yet fully characterized or linked to a specific disease. Ignoring such data represents a failure to fully characterize the hazard and can lead to the underestimation of potential adverse health effects, violating the toxicologist's duty to protect public health. Third incorrect approach involves prioritizing the most commonly studied mechanisms of action, even if they do not fully explain the observed toxicological findings. This is a scientific failure because it imposes preconceived notions onto the data, rather than allowing the data to guide the interpretation. The U.S. regulatory framework encourages the exploration of novel mechanisms and the adaptation of assessment strategies to new scientific understanding. This approach demonstrates a lack of critical thinking and an unwillingness to engage with the specific nuances of the chemical and its observed effects. Professional reasoning. When faced with novel toxicological findings and mechanistic data, professionals should adopt a systematic approach. First, thoroughly review all available data, including in vitro, in vivo, and in silico studies, to understand the observed effects and the proposed mechanisms. Second, critically evaluate the biological plausibility and relevance of the mechanistic pathways to potential human exposure scenarios. Third, consult relevant scientific literature and regulatory guidance documents, even if they do not directly address the specific endpoint, to inform the interpretation of the data. Fourth, consider the uncertainties and limitations of the data and their potential impact on risk assessment. Finally, communicate findings clearly and transparently, highlighting both the strengths and weaknesses of the assessment and recommending further research or risk management strategies as appropriate. This iterative process ensures that decisions are grounded in the best available science and adhere to regulatory and ethical standards. Question 7. Market research demonstrates a growing interest among toxicologists in understanding the foundational principles that underpin modern regulatory science. Considering the historical development of toxicology and its influence on current practices, which of the following represents the most significant early contribution that directly shaped the scientific basis for toxicological risk assessment and regulation? Option A. The initial isolation and characterization of various toxic compounds found in nature. Option B. The invention of early laboratory equipment for chemical analysis. Option C. The detailed documentation of historical poisoning incidents and their immediate symptoms. Option D. The systematic investigation of the relationship between dose and effect, establishing that the dose makes the poison. The correct answer is D. The systematic investigation of the relationship between dose and effect, establishing that the dose makes the poison. Explanation. This scenario presents a professional challenge because it requires a toxicologist to navigate the historical context of toxicology within the specific regulatory framework of the DABT certification. The challenge lies in accurately identifying the foundational contributions that shaped current toxicological practices and regulatory oversight, as recognized by the DABT scope. A deep understanding of this history is crucial for demonstrating comprehensive knowledge expected of a diplomate. The correct approach represents best professional practice because it directly aligns with the historical evolution of toxicology as a scientific discipline and its subsequent integration into regulatory frameworks that the DABT certification aims to uphold. Identifying Paracelsus as a pivotal figure in establishing dose-response relationships and the concept of the dose makes the poison is fundamental to understanding the scientific underpinnings of modern toxicology and risk assessment, which are core to DABT purview. This historical insight informs the ethical and scientific rigor required in toxicological practice. An incorrect approach that focuses solely on early chemical discoveries without acknowledging their toxicological implications fails to grasp the historical development of toxicology as a distinct field. This overlooks the critical shift from mere chemical identification to understanding biological effects and safety. Another incorrect approach that emphasizes purely observational accounts of poisoning without the systematic investigation of cause and effect misses the scientific methodology that Paracelsus and subsequent toxicologists introduced, which is essential for regulatory science. Finally, an approach that prioritizes the development of analytical techniques over the conceptual breakthroughs in understanding toxicity mechanisms neglects the foundational principles that guided the application of these techniques in a regulatory context. These failures represent a lack of understanding of the historical trajectory that led to the current regulatory landscape and the scientific principles that govern toxicological assessment, which are implicitly tested by the DABT. The professional decision-making process for similar situations should involve a critical evaluation of historical contributions through the lens of their impact on scientific understanding and regulatory application. Professionals should ask, which historical developments directly laid the groundwork for the principles and practices that are now codified in regulatory guidelines and assessed in professional certifications like the DABT. This requires moving beyond simple chronological listing to understanding the conceptual and methodological shifts that define the field. Question 8. During the evaluation of a community's concern regarding potential exposure to a novel industrial chemical released into a local waterway, which approach best aligns with the principles of responsible biomonitoring and environmental surveillance under U.S. regulatory frameworks? Option A. Immediately implement biomonitoring for a single, recently published biomarker that shows promise in preliminary animal studies for detecting general chemical exposure, without prior confirmation of its relevance to the specific industrial chemical or its presence in the local environment. Option B. Rely on anecdotal reports from community members about perceived health symptoms and initiate biomonitoring based on these subjective accounts, prioritizing biomarkers associated with common ailments like fatigue and headaches. Option C. Conduct a thorough literature review of the novel chemicals' known toxicological properties. Consult relevant U.S. Environmental Protection Agency, EPA, and Agency for Toxic Substances and Disease Registry, ATSTR, guidelines for chemical assessment, and if warranted, develop a targeted biomonitoring plan for specific, validated biomarkers of exposure or effect. Option D. Initiate widespread biomonitoring for a broad panel of general biomarkers of stress and inflammation in the affected population, while simultaneously requesting emergency funding for research into the specific toxicokinetics of the novel chemical. The correct answer is D. Initiate widespread biomonitoring for a broad panel of general biomarkers of stress and inflammation in the affected population, while simultaneously requesting emergency funding for research into the specific toxicokinetics of the novel chemical. Explanation. This scenario presents a common challenge in biomonitoring and environmental surveillance, balancing the need for comprehensive data with the practical limitations of resource allocation and the ethical considerations of public health. The professional challenge lies in identifying the most effective and ethically sound strategy for investigating a potential environmental exposure without causing undue alarm or misdirecting limited resources. Careful judgment is required to prioritize actions that are scientifically valid, regulatorily compliant, and protective of public health. The correct approach represents best professional practice because it aligns with the principles of risk assessment and public health investigation. It prioritizes a systematic, evidence-based approach that begins with understanding the existing scientific literature and regulatory guidelines. This ensures that any subsequent biomonitoring is targeted, relevant, and interpretable within established frameworks. It also emphasizes communication and collaboration with regulatory bodies, which is crucial for ensuring compliance and effective public health response. The ethical imperative is to act responsibly, avoiding premature conclusions or actions that could lead to unnecessary anxiety or misallocation of resources. An incorrect approach that focuses solely on immediate, widespread biomonitoring without prior investigation fails to adhere to principles of efficient resource management and responsible public health practice. It risks generating data that may be difficult to interpret, leading to potential overreaction or underreaction. Ethically, it can cause undue public concern without a clear scientific basis. Another incorrect approach that relies on anecdotal evidence or unsubstantiated claims to justify biomonitoring bypasses the scientific rigor required for environmental health investigations. This approach is ethically problematic as it can lead to decisions based on misinformation, potentially harming individuals or communities through unnecessary interventions or by diverting attention from genuine risks. It also undermines the credibility of the toxicological profession and regulatory oversight. A third incorrect approach that prioritizes a single, unvalidated biomarker without considering the full toxicological profile of the suspected agent or the established biomonitoring protocols is scientifically unsound. This can lead to false positives or negatives, misinterpretation of results, and ultimately, ineffective public health interventions. It fails to meet the professional standard of thoroughness and scientific validity expected in toxicology. The professional decision-making process for similar situations should involve a structured risk assessment framework. This includes 1. Clearly defining the suspected exposure and potential health outcomes. 2. Reviewing existing scientific literature and regulatory guidance for relevant biomarkers and exposure limits. 3. Consulting with relevant regulatory agencies, e.g., EPA, to understand existing data and protocols. 4. Designing a targeted biomonitoring strategy based on scientific evidence and regulatory requirements, if deemed necessary. And 5. Ensuring clear and transparent communication with stakeholders throughout the process. Question 9. The risk matrix shows a novel chemical with conflicting data regarding its primary mechanism of toxicity. One set of studies suggests genotoxicity as the main driver of adverse effects, while another robust set of in vivo studies points towards oxidative stress leading to cellular damage. Both mechanisms are biologically plausible, considering the regulatory framework for toxicological assessment in the United States, which approach best guides the determination of the primary mechanism of toxicity. Option A. Conduct a thorough weight of evidence analysis, critically evaluating the quality, relevance, and consistency of all available studies, including those on genotoxicity and oxidative stress, to determine the most consistently supported and biologically relevant mechanism. Option B. Prioritize the genotoxicity findings due to their direct link to DNA damage and potential for carcinogenicity, assuming this is the most critical endpoint for regulatory concern. Option C. Focus solely on the in vivo studies demonstrating oxidative stress, as these represent a more complex biological system and are therefore more indicative of real-world exposure scenarios. Option D. Seek immediate guidance from industry stakeholders to understand which mechanism is most likely to impact product development timelines and regulatory approval processes. The correct answer is B. Prioritize the genotoxicity findings due to their direct link to DNA damage and potential for carcinogenicity, assuming this is the most critical endpoint for regulatory concern. Explanation. Scenario analysis. This scenario presents a toxicologist with a complex challenge involving the interpretation of disparate toxicity data for a novel chemical. The professional difficulty lies in reconciling conflicting findings regarding a specific mechanism of toxicity, which directly impacts risk assessment and regulatory recommendations. The need for careful judgment is paramount, as an inaccurate conclusion about the primary mechanism could lead to either underestimation of risk, potentially harming public health, or overestimation, leading to unnecessary economic burdens and hindering innovation. The absence of established regulatory guidelines for this specific novel chemical further amplifies the challenge, requiring the toxicologist to rely on fundamental principles and robust scientific reasoning. Correct approach analysis. The correct approach involves a systematic evaluation of the available data, prioritizing studies that employ well-validated methodologies and are conducted under good laboratory practice, GLP principles, as mandated by U.S. regulatory frameworks such as those overseen by the EPA and FDA. This approach emphasizes identifying the most robust evidence for a particular mechanism, considering dose-response relationships, and assessing the biological plausibility of the proposed pathway. It aligns with the DABT emphasis on scientific rigor and evidence-based toxicology. By focusing on the weight of evidence and the quality of the studies, the toxicologist can confidently identify the most likely primary mechanism, which is essential for accurate hazard identification and risk characterization under U.S. regulations. Incorrect approaches analysis. One incorrect approach involves prematurely concluding the primary mechanism based on a single, albeit concerning, study without considering the broader dataset. This fails to adhere to the principle of evaluating the totality of evidence, a cornerstone of regulatory toxicology in the U.S. It could lead to an overemphasis on a mechanism that is not consistently observed or is a secondary effect, violating the requirement for scientifically sound risk assessment. Another incorrect approach is to dismiss a potential mechanism solely because it is novel or less understood, without a thorough investigation of the supporting data. U.S. regulatory bodies encourage the consideration of emerging scientific knowledge, provided it is supported by credible evidence. Ignoring a plausible mechanism due to its unfamiliarity can lead to an incomplete risk assessment, potentially overlooking significant hazards. A third incorrect approach is to rely on anecdotal evidence or expert opinion without substantiating it with empirical data from well-designed studies. While expert judgment is valuable, it must be grounded in scientific evidence. U.S. regulatory frameworks require data-driven conclusions, and decisions based purely on speculation or unverified claims are professionally unacceptable and ethically unsound. Professional reasoning. Professionals should approach such situations by first clearly defining the question regarding the mechanism of toxicity. They should then conduct a comprehensive literature search, critically appraising the quality and relevance of each study. A systematic review and meta-analysis, if appropriate, can help synthesize findings. The weight of evidence should be carefully considered, giving precedence to GLP-compliant studies and those employing validated endpoints. When conflicting data exists, the toxicologist must explore potential reasons for the discrepancies, such as differences in experimental design, exposure conditions, or species. Ultimately, the conclusion regarding the primary mechanism should be based on the most robust and consistent scientific evidence, clearly articulating any uncertainties and their implications for risk assessment. This systematic, evidence-based approach ensures compliance with U.S. regulatory expectations for toxicological evaluations. Question 10. The efficiency study reveals that a particular industrial facility has been identified as a potential source of a novel airborne particulate. While initial monitoring focused on ambient air concentrations downwind of the facility, preliminary data suggests that workers within the facility may experience significantly higher exposures through inhalation of dust generated during specific manufacturing processes, and potentially through dermal contact with contaminated surfaces. Furthermore, there is a possibility of indirect exposure to the community through deposition of these particulates onto local agricultural produce. Given these multiple potential sources and routes, which approach best characterizes the overall exposure scenario for both occupational and general populations, adhering to U.S. regulatory principles for toxicological risk assessment. Option A. Rely on existing generic exposure models for airborne particulates, assuming the novel particulate behaves similarly to well-studied substances, to estimate both worker and community exposures without site-specific data collection. Option B. Focus exclusively on ambient air monitoring data downwind of the facility, as this represents the primary pathway for community exposure and is the most straightforward to measure. Option C. Conduct a comprehensive exposure assessment that systematically evaluates inhalation and dermal routes for occupational exposure, and inhalation and ingestion routes for community exposure, considering all identified sources and their potential contributions. Option D. Prioritize detailed assessment of inhalation exposure within the facility for workers, as this is likely to yield the highest individual dose, and assume community exposure is negligible without further evidence. The correct answer is B. Focus exclusively on ambient air monitoring data downwind of the facility, as this represents the primary pathway for community exposure and is the most straightforward to measure. Explanation. This scenario presents a professional challenge because it requires a toxicologist to interpret and apply complex regulatory requirements for exposure assessment in a real-world setting, where data may be incomplete or ambiguous. The challenge lies in selecting the most appropriate method for characterizing exposure when faced with multiple potential sources and routes, ensuring that the chosen method aligns with the principles of risk assessment and regulatory compliance under the framework governing the DABT certification. Careful judgment is required to balance scientific rigor with practical limitations and regulatory mandates. The correct approach represents best professional practice because it prioritizes a comprehensive and systematic evaluation of all plausible exposure pathways. This aligns with the U.S. regulatory framework, which emphasizes a thorough understanding of how individuals might come into contact with a toxic substance. By considering both direct and indirect routes, and by evaluating the relative contributions of different sources, the toxicologist ensures that the exposure assessment is robust and defensible. This approach is ethically sound as it aims to protect public health by accurately identifying and quantifying risks, thereby informing appropriate risk management strategies. It adheres to the principles of good scientific practice and the expectations of regulatory bodies overseeing toxicology. An incorrect approach that relies solely on readily available or easily measurable data, without considering other potential routes or sources, would be professionally unacceptable. This failure stems from a lack of due diligence and an incomplete risk characterization, which could lead to underestimation of exposure and, consequently, inadequate protective measures. Such an approach violates the ethical obligation to conduct thorough and accurate assessments. Another incorrect approach that focuses only on the most obvious or historically significant exposure route, while ignoring emerging or less apparent pathways, also represents a regulatory and ethical failure. This can occur due to bias or a failure to adapt to new information or changing environmental conditions. It fails to meet the comprehensive requirements of exposure assessment mandated by regulatory guidelines, potentially leaving populations vulnerable to unaddressed risks. A further incorrect approach that prioritizes speed or cost-effectiveness over scientific accuracy and regulatory compliance would be a significant professional failing. While efficiency is important, it must not compromise the integrity of the exposure assessment. Regulatory frameworks demand a high standard of scientific evidence and a thorough process, and shortcuts that undermine this are unacceptable. The professional decision-making process for similar situations should involve a structured approach. 1. Clearly define the toxic substance and the population at risk. 2. Identify all potential sources of the toxic substance. 3. For each source, identify all plausible routes of exposure, inhalation, dermal, ingestion, etc. 4. Gather available data on the presence and concentration of the toxic substance in various media, air, water, soil, food, consumer products. 5. Evaluate the likelihood and magnitude of exposure via each identified route, considering factors such as frequency, duration, and intensity of contact. 6. Prioritize exposure pathways for detailed assessment based on their potential contribution to overall exposure. 7. Select appropriate methodologies for exposure quantification, ensuring they are scientifically sound and meet regulatory requirements. 8. Document the entire process, including assumptions, data limitations, and the rationale for decisions made. 9. Communicate findings clearly and effectively to relevant stakeholders. Question 11. Regulatory review indicates a cluster of unexplained neurological symptoms in a community downstream from a newly established industrial facility. Preliminary environmental sampling has detected a novel synthetic organic compound in the local water supply. The primary objective is to determine if this compound is the causative agent, and if so, to establish the toxicological basis for the observed health effects to inform regulatory intervention. Which branch of toxicology is most critical for guiding the initial investigation and subsequent risk assessment under U.S. regulatory frameworks? Option A. Environmental toxicology, focusing on the compound's fate and transport in the environment and its potential to reach human populations, coupled with mechanistic toxicology to understand how it interacts with biological systems to cause neurological damage. Option B. Forensic toxicology, primarily concerned with identifying the presence of the compound in biological samples and determining the time of exposure. Option C. Ecotoxicology, concentrating on the compound's effects on aquatic organisms and ecosystem health. Option D. Industrial hygiene, focusing on workplace exposure controls and personal protective equipment for workers at the facility. The correct answer is A. Environmental toxicology, focusing on the compound's fate and transport in the environment and its potential to reach human populations, coupled with mechanistic toxicology to understand how it interacts with biological systems to cause neurological damage. Explanation. This scenario presents a professional challenge due to the need to accurately identify the most relevant branch of toxicology for a novel chemical exposure investigation, ensuring that regulatory compliance and public health protection are prioritized. The complexity arises from the potential overlap of toxicological disciplines and the critical importance of selecting the approach that best addresses the specific exposure context and regulatory mandate. The correct approach represents best professional practice, because it directly aligns with the principles of risk assessment and regulatory science as applied in the United States. By focusing on identifying the toxicological endpoints and mechanisms of action relevant to the observed human health effects, this approach facilitates the accurate characterization of risk and informs appropriate regulatory actions. This is consistent with the overarching goals of toxicology as a discipline, which include understanding adverse effects and preventing harm, as guided by U.S. regulatory frameworks such as those established by the EPA and FDA. An incorrect approach that focuses solely on the chemical's physical properties without considering its biological interactions fails to address the core toxicological question of whether the substance poses a health hazard. This is a regulatory failure because it neglects the fundamental requirement to assess toxicity and potential harm to human health and the environment, which is a cornerstone of U.S. environmental and public health regulations. Another incorrect approach that prioritizes academic classification of the chemical over its observed effects is also a regulatory and ethical failure. While understanding chemical classification is important, it does not directly inform the assessment of adverse health outcomes in an exposed population. This approach would lead to a misallocation of resources and potentially ineffective risk management strategies, failing to meet the public health objectives mandated by U.S. regulatory bodies. A further incorrect approach that relies on anecdotal evidence without systematic toxicological investigation is a critical failure in professional practice and regulatory compliance. Toxicology relies on scientific methodology and data-driven conclusions. Anecdotal evidence, while potentially a starting point for suspicion, is insufficient for regulatory decision-making and can lead to misinformed conclusions, potentially endangering public health. The professional decision-making process for similar situations should involve a systematic evaluation of the exposure scenario, the available toxicological data, or the need for new data, and the specific regulatory questions that need to be answered. This involves clearly defining the problem, identifying the relevant toxicological disciplines, e.g., environmental, occupational, clinical, forensic, reproductive, developmental, genetic toxicology, and selecting the most appropriate methodologies to gather and interpret data that will inform risk assessment and regulatory action within the U.S. framework. Question 12. Governance review demonstrates that a toxicologist is tasked with evaluating the potential health risk associated with a newly identified environmental contaminant. The toxicologist must select the most appropriate framework for this evaluation, ensuring it aligns with U.S. regulatory requirements for toxicology. Which of the following approaches best reflects the standard methodology for risk assessment in this context? Option A. Characterizing the probability and magnitude of adverse health effects in the exposed population based on hazard identification, dose-response assessment, exposure assessment, and risk characterization. Option B. Relying exclusively on historical toxicity data from similar compounds without considering current scientific advancements or specific exposure pathways. Option C. Extrapolating risk based on the most extreme, worst-case exposure scenario, even if it is highly improbable. Option D. Identifying all potential hazards associated with the contaminant, irrespective of likely exposure levels in the environment. The correct answer is A. Characterizing the probability and magnitude of adverse health effects in the exposed population based on hazard identification, dose-response assessment, exposure assessment, and risk characterization. Explanation. This scenario presents a professional challenge because it requires a toxicologist to interpret and apply risk assessment principles in a context where regulatory compliance is paramount and potential public health implications are significant. The challenge lies in selecting the most appropriate and scientifically defensible approach to characterizing risk, ensuring it aligns with established U.S. regulatory frameworks for toxicology. Careful judgment is required to balance scientific rigor with the practical demands of regulatory decision-making. The correct approach represents best professional practice because it directly addresses the core components of a comprehensive risk assessment as mandated by U.S. regulatory bodies like the EPA. This involves hazard identification, dose-response assessment, exposure assessment, and risk characterization. By focusing on characterizing the probability and magnitude of adverse health effects in the exposed population, this approach adheres to the principles of risk assessment that underpin regulatory decision-making in toxicology. It ensures that the assessment is grounded in scientific evidence and provides a clear basis for risk management decisions. An incorrect approach that solely focuses on hazard identification without considering exposure is professionally unacceptable. This failure stems from an incomplete risk assessment, violating the fundamental principle that risk is a function of both hazard and exposure. Regulatory frameworks require a complete picture to make informed decisions. Another incorrect approach that prioritizes the most conservative exposure scenario without considering its likelihood or relevance to the actual population is also flawed. While conservatism is sometimes employed, an uncritical application can lead to overestimation of risk, potentially resulting in unnecessary or overly burdensome regulatory actions. This deviates from the goal of a scientifically sound and proportionate risk assessment. Finally, an approach that relies solely on historical data without updating for current scientific understanding or exposure patterns is inadequate. Regulatory toxicology demands that assessments be current and reflect the best available scientific knowledge. The professional reasoning process for similar situations should involve a systematic evaluation of the available data, a thorough understanding of the relevant U.S. regulatory guidelines, e.g., EPA's risk assessment guidelines, and a clear articulation of the assumptions and uncertainties inherent in the assessment. Toxicologists must critically assess each step of the risk assessment process, ensuring scientific validity and regulatory compliance. They should be prepared to justify their chosen methodologies and interpretations to regulatory agencies and stakeholders, demonstrating a commitment to public health and sound scientific practice. Question 13. Stakeholder feedback indicates a need for clearer communication regarding the relationship between chemical exposure levels and observed toxicological effects. When evaluating a new chemical's toxicological profile, which approach best aligns with the principles of dose-response assessment and responsible risk communication within the U.S. regulatory framework? Option A. Focus on the lowest observed adverse effect level, LOL, as the primary determinant of risk, regardless of the dose-response curve shape or the relevance of the observed effects to human health. Option B. Emphasize the most sensitive toxicological endpoint identified in studies, even if it occurs at extremely high doses with little relevance to typical human exposure scenarios. Option C. Characterize the full dose-response curve, identifying key points such as the no observed adverse effect level, NOAL, or benchmark dose, BMD, and discuss the shape of the curve and associated uncertainties in relation to potential human exposures. Option D. Extrapolate a safe exposure level based on anecdotal reports of adverse effects at high doses, without detailed analysis of the dose-response data. The correct answer is C. Characterize the full dose-response curve, identifying key points such as the no observed adverse effect level, NOAL, or benchmark dose, BMD, and discuss the shape of the curve and associated uncertainties in relation to potential human exposures. Explanation. This scenario is professionally challenging because it requires a toxicologist to interpret and communicate complex dose-response data to non-expert stakeholders, balancing scientific accuracy with practical implications for risk assessment and regulatory compliance. The core challenge lies in translating the nuances of dose-response relationships, such as thresholds, nonlinearities, and uncertainty, into actionable insights without oversimplifying or misrepresenting the scientific findings. Careful judgment is required to ensure that the communication is both scientifically sound and understandable to diverse audiences, influencing decisions that impact public health and safety. The correct approach represents best professional practice because it prioritizes a thorough understanding of the dose-response data and its limitations before engaging with stakeholders. This involves critically evaluating the quality and relevance of the data, identifying key dose-response features, e.g., NOAL, LOAL, benchmark dose, and considering the uncertainties inherent in extrapolating from experimental conditions to real-world exposures. By framing the discussion around established toxicological principles and regulatory guidance, such as those implicitly guiding DABT certification regarding risk assessment, the toxicologist can provide a scientifically defensible and ethically responsible interpretation. This approach ensures that decisions are informed by robust scientific evidence and that potential risks are communicated transparently, aligning with the principles of good scientific practice and regulatory oversight. An incorrect approach that focuses solely on identifying a single safe dose without acknowledging the underlying dose-response curve and its uncertainties fails to adhere to fundamental toxicological principles. Dose-response relationships are rarely characterized by a simple, absolute safe threshold for all individuals. Ignoring this complexity can lead to an underestimation of risk or the establishment of inappropriate regulatory limits, violating the ethical obligation to protect public health. Another incorrect approach that emphasizes the most sensitive endpoint without considering the dose at which it occurs, or the relevance of that endpoint to human health, is also professionally unacceptable. This can lead to alarmist conclusions or the misallocation of resources if the identified sensitive endpoint is not a significant concern at relevant exposure levels. It demonstrates a lack of critical evaluation of the dose-response data in the context of actual or potential human exposure. A third incorrect approach that relies on anecdotal evidence or generalized statements about toxicity, rather than the specific dose-response data for the substance in question, represents a significant departure from scientific rigor. This approach undermines the credibility of the toxicological assessment and can lead to misinformed decisions based on speculation rather than evidence. It fails to meet the professional standards expected of a toxicologist, particularly one seeking or maintaining DABT certification, which emphasizes evidence-based practice. The professional decision-making process for similar situations should involve a systematic evaluation of the available dose-response data, a thorough understanding of the relevant regulatory framework and guidance, and a clear communication strategy tailored to the audience. This includes identifying the key features of the dose-response relationship, quantifying uncertainty, and articulating the implications for risk assessment and management in a clear, concise, and scientifically accurate manner. Transparency about limitations and uncertainties is crucial for building trust and ensuring informed decision-making. Question 14. Implementation of a streamlined hazard identification process for a new chemical substance under TSCA, considering limited budget and timeline, requires careful selection of an approach. Which of the following strategies best optimizes this process while adhering to regulatory expectations for thoroughness? Option A. Prioritize a comprehensive review and critical evaluation of all existing publicly available literature, regulatory databases, and relevant in silico predictions, followed by a targeted in vitro testing strategy for any identified data gaps. Option B. Focus solely on identifying hazards that are most commonly associated with similar chemical classes, without investigating unique or less common toxicological endpoints. Option C. Rely exclusively on readily accessible summary reports from industry consortia, without independent critical assessment of the underlying data quality or relevance. Option D. Immediately initiate a battery of high-throughput in vitro assays and advanced computational modeling to generate novel data, bypassing a thorough review of existing information. The correct answer is A. Prioritize a comprehensive review and critical evaluation of all existing publicly available literature, regulatory databases, and relevant in silico predictions, followed by a targeted in vitro testing strategy for any identified data gaps. Explanation. This scenario presents a professional challenge in hazard identification by requiring the toxicologist to optimize a process under resource constraints while ensuring regulatory compliance and scientific rigor. The challenge lies in balancing efficiency with the thoroughness necessary for accurate hazard identification, which is foundational to risk assessment and subsequent regulatory actions. Careful judgment is required to select an approach that maximizes the utility of available data and resources, without compromising the integrity of the hazard identification process. The correct approach represents best professional practice because it prioritizes a systematic, data-driven evaluation of existing information before investing in new studies. This aligns with the principles of good regulatory science, which encourages the use of available data and tiered approaches to minimize unnecessary testing, thereby being both cost-effective and ethically sound by avoiding animal testing where possible. Specifically, within the U.S. regulatory framework, agencies like the EPA often emphasize the use of existing data, read-across, and in silico methods as initial steps in hazard identification, as mandated by statutes like the Toxic Substances Control Act, TSCA, which promotes the use of alternative methods and data. This approach ensures that decisions are based on the best available scientific evidence and are defensible under regulatory scrutiny. An incorrect approach that relies solely on readily available but potentially outdated or incomplete. Literature without critical evaluation fails to meet the standard of thoroughness expected in hazard identification. This could lead to overlooking significant hazards or mischaracterizing the nature of a hazard, potentially resulting in inadequate risk management measures and noncompliance with regulatory requirements for comprehensive hazard assessment. Another incorrect approach that immediately jumps to expensive, novel testing without first exploring existing data is inefficient and ethically questionable, particularly if existing data could have adequately identified the hazard. This disregards the principles of data utilization and potentially leads to unnecessary resource expenditure and animal use, which is contrary to the spirit of many U.S. environmental regulations. The professional reasoning process should involve a critical assessment of the project's objectives, available resources, and regulatory context. A toxicologist should first conduct a comprehensive literature search and database review, followed by an evaluation of existing in vitro and in silico data. If significant data gaps or uncertainties remain after this initial assessment, a tiered approach to further testing, prioritizing less resource-intensive and ethically preferable methods, should be considered. This systematic process ensures that hazard identification is robust, efficient, and compliant with relevant U.S. regulations. Question 15. System analysis indicates that a novel industrial chemical, when tested in a human hepatocyte cell line, induces significant endoplasmic reticulum stress and subsequent activation of the unfolded protein response, upper pathway at concentrations exceeding 50 μm. At concentrations above 100 μm, widespread apoptosis is observed. The chemical is not known to be genotoxic or mutagenic. Considering the principles of toxicology and risk assessment, which of the following represents the most scientifically sound interpretation of these findings in the context of potential human health risk? Option A. The induction of UPR and apoptosis in vitro is a common cellular defense mechanism and is unlikely to translate to significant human health risk at typical occupational exposure levels, as these effects are only seen at supraphysiological concentrations. Option B. The observed endoplasmic reticulum stress and apoptosis in human hepatocytes at high concentrations suggest a potential for liver toxicity in humans upon significant exposure, warranting further investigation into dose-response relationships and potential exposure routes. Option C. The primary concern should be the immediate genotoxic potential, and since none was observed, the endoplasmic reticulum stress and apoptosis are not relevant endpoints for human risk assessment. Option D. The chemical's lack of genotoxicity and mutagenicity indicates it poses no significant long-term health risk, and the observed cellular responses are merely artifacts of the in vitro testing system. The correct answer is B. The observed endoplasmic reticulum stress and apoptosis in human hepatocytes at high concentrations suggest a potential for liver toxicity in humans upon significant exposure, warranting further investigation into dose-response relationships and potential exposure routes. Explanation. Scenario analysis. This scenario presents a professionally challenging situation because it requires a toxicologist to interpret complex cellular responses to a novel chemical entity without extensive prior human data. The challenge lies in extrapolating in vitro findings to potential in vivo effects and then to human health risk, necessitating a thorough understanding of cellular mechanisms and their implications for systemic toxicity. The absence of established human exposure limits or comprehensive toxicological profiles for this specific compound amplifies the need for rigorous scientific judgment and adherence to established risk assessment principles. Correct approach analysis. The correct approach involves a systematic evaluation of the observed cellular responses, linking them to known toxicological pathways, and considering the potential for dose-dependent effects and extrapolation to human exposure scenarios. This aligns with the principles of toxicology risk assessment, which emphasize understanding the hazard, cellular response, and then characterizing the exposure and risk. By considering the reversibility of the observed changes, the potential for adaptation, and the relevance of the cellular model to human physiology, the toxicologist can build a scientifically sound basis for risk characterization. This approach is best professional practice as it is grounded in scientific evidence, follows established risk assessment paradigms, and prioritizes a comprehensive understanding of the toxicological profile before making conclusions about human health implications. It adheres to the ethical obligation to conduct thorough and unbiased scientific evaluations. Incorrect approach is analysis. One incorrect approach would be to immediately conclude significant human health risk based solely on the observation of cellular damage, without considering dose, reversibility, or the relevance of the cellular model. This fails to adhere to the principles of dose response and risk assessment, potentially leading to overestimation of hazard and unnecessary alarm. Ethically, it violates the principle of scientific integrity by making premature and unsubstantiated conclusions. Another incorrect approach would be to dismiss the observed cellular changes as irrelevant because they occur at high concentrations in vitro, without considering the potential for accumulation or prolonged exposure in vivo, or the possibility that lower concentrations might elicit subtler but still significant effects over time. This ignores the principle of considering all potential exposure scenarios and the cumulative nature of some toxic effects. It also fails to acknowledge that in vitro systems, while not perfect, can provide valuable mechanistic insights. A third incorrect approach would be to focus solely on identifying a single molecular target without considering the broader cellular context and the potential for multiple interacting pathways to contribute to toxicity. This reductionist view can overlook synergistic or antagonistic effects and lead to an incomplete understanding of the toxicological profile. It deviates from a holistic approach to toxicology that considers the complex interplay of cellular processes. Professional reasoning. Professionals should approach such situations by first meticulously documenting the observed cellular responses and their characteristics, e.g., type of damage, magnitude, dose dependency. This should be followed by a thorough literature search to identify similar responses to known toxicants and to understand the underlying molecular mechanisms. The next step involves critically evaluating the relevance of the in vitro model to human physiology and considering potential extrapolation challenges. Finally, the toxicologist must integrate all available data, including mechanistic insights and dose-response relationships, to characterize the hazard and inform risk assessment, always maintaining scientific objectivity and transparency. Question 16. The monitoring system demonstrates a statistically significant increase in the incidence of a specific adverse event in patients receiving a newly approved pharmaceutical, which is not reflected in the drug's current U.S. Food and Drug Administration (FDA) approved labeling. Preliminary analysis suggests a potential alteration in the drug's metabolic pathway, leading to an accumulation of a toxic metabolite, thereby impacting its distribution and excretion. As the responsible toxicologist, what is the most appropriate immediate course of action to ensure public safety and regulatory compliance? Option A. Disregard the monitoring data as potentially erroneous, assuming the drug's approved ADME profile is accurate and no further action is immediately required. Option B. Initiate an immediate, comprehensive investigation into the observed adverse events, correlating them with the drug's known ADME profile and the monitoring data, and prepare to report any confirmed safety signals to the FDA. Option C. Advise the pharmaceutical company to voluntarily withdraw the drug from the market pending a full investigation, without first consulting regulatory authorities. Option D. Conduct further internal studies to definitively prove causality before any communication with external parties, including regulatory agencies. The correct answer is B. Initiate an immediate, comprehensive investigation into the observed adverse events, correlating them with the drug's known ADME profile and the monitoring data, and prepare to report any confirmed safety signals to the FDA. Explanation. Scenario analysis. This scenario presents a professional challenge due to the potential for a significant public health risk stemming from an unexpected ADME profile of a newly approved pharmaceutical. The toxicologist is faced with conflicting information, the drug's approved labeling, and the real-world monitoring data. The ethical dilemma lies in balancing the immediate need to protect public health against the potential disruption to patient care and the pharmaceutical company's reputation, all while adhering to regulatory obligations. Careful judgment is required to interpret the data, assess the risk, and determine the appropriate course of action within the established regulatory framework. Correct approach analysis. The correct approach involves a thorough, data-driven investigation that prioritizes patient safety and regulatory compliance. This includes immediately initiating a comprehensive review of the monitoring data, comparing it against the drug's known ADME properties and the approved labeling, and consulting relevant scientific literature. If the data suggests a potential safety signal related to DABT, the toxicologist has a professional and ethical obligation to report these findings to the appropriate regulatory authorities, such as the U.S. Food and Drug Administration, FDA, as mandated by regulations like the Federal Food, Drug, and Cosmetic Act, FD&C Act, and its implementing regulations concerning post-market surveillance and adverse event reporting. This proactive reporting ensures that regulatory bodies can assess the risk and take necessary actions, such as updating labeling or issuing safety communications, thereby protecting the public. Incorrect approach is analysis. One incorrect approach would be to dismiss the monitoring data as anomalous without rigorous investigation. This fails to uphold the toxicologist's responsibility to identify and report potential safety concerns, potentially violating ethical principles of beneficence and non-maleficence. It also neglects the regulatory requirement for post-market surveillance and the reporting of adverse events, which are crucial for ensuring drug safety after approval. Another incorrect approach would be to immediately recommend a public recall or widespread withdrawal of the drug based solely on preliminary monitoring data, without a thorough risk assessment and confirmation of a causal link to adverse events. This could lead to unnecessary panic, disrupt patient treatment, and cause significant economic harm, while potentially being premature if the observed effects are not definitively linked to the drug or are manageable. This approach bypasses the established regulatory process for evaluating and managing drug safety issues. A third incorrect approach would be to delay reporting the findings to regulatory authorities while awaiting further internal investigation or discussions with the pharmaceutical company. This delay can put patients at continued risk and violates the spirit, if not the letter, of regulations requiring timely reporting of significant safety information. The primary responsibility of a toxicologist in such a situation is to public health, which necessitates prompt communication with regulatory bodies. Professional reasoning. Professionals should adopt a systematic, evidence-based decision-making process. This involves 1. Data acquisition and initial assessment. Gather all relevant data from the monitoring system and compare it with existing knowledge. 2. Risk identification and characterization. Determine if the observed data suggests a potential safety issue related to DABT and assess its potential severity and likelihood. 3. Consultation and collaboration. Engage with relevant experts and stakeholders, including internal medical and regulatory affairs teams. 4. Regulatory reporting. If a potential safety signal is identified, follow established protocols for reporting to regulatory agencies, e.g., FDA MedWatch. 5. Risk management and mitigation. Based on regulatory guidance and further investigation, contribute to the development of appropriate risk management strategies. This process ensures that decisions are informed, ethical, and compliant with U.S. regulations. Question 17. Governance review demonstrates that a chemical manufacturing facility has identified potential airborne exposure to a heavy metal for which the Occupational Safety and Health Administration (OSHA) has not promulgated a specific permissible exposure limit, PEL. The company's Environmental Health and Safety Department is seeking guidance on how to manage this potential exposure. Which of the following represents the most appropriate course of action for the toxicologist to recommend? Option A. Suggest the company establish an internal exposure limit based on the opinions of experienced production staff. Option B. Advise the company that no action is required as long as there is no specific OSHA PEL for the heavy metal. Option C. Recommend implementing engineering controls and administrative measures to reduce exposure to the lowest feasible level, utilizing guidance from authoritative sources such as NIOSH recommended exposure limits, REL, or ECG threshold limit values, TLV, as benchmarks, and conducting a thorough risk assessment. Option D. Recommend that the company wait for OSHA to establish a PEL before taking any preventative measures. The correct answer is C. Recommend implementing engineering controls and administrative measures to reduce exposure to the lowest feasible level, utilizing guidance from authoritative sources such as NIOSH recommended exposure limits, REL, or ECG threshold limit values, TLV, as benchmarks, and conducting a thorough risk assessment. Explanation. Scenario analysis. This scenario presents a common challenge in occupational toxicology, where a company identifies potential exposure to a heavy metal without a clear, established occupational exposure limit (OL), specifically for that metal within the U.S. regulatory framework. The challenge lies in balancing worker protection with the practicalities of implementing controls when definitive regulatory guidance is absent. This requires a toxicologist to exercise professional judgment, drawing upon available scientific data and established principles of risk assessment and management, while remaining compliant with overarching OSHA requirements for a safe workplace. Correct approach analysis. The correct approach involves a proactive and scientifically grounded strategy. It acknowledges the lack of a specific OSHA PEL, but leverages the General Duty Clause of the OSH Act, which mandates employers provide a workplace free from recognized hazards. This necessitates consulting authoritative sources like NIOSH recommended exposure limits, REL, or ECG threshold limit values, TLV, as best practice benchmarks, even if not legally binding OSHA standards. The toxicologist should then conduct a thorough risk assessment, considering the properties of the metal, the nature of the work, potential exposure routes, and the available scientific literature on its toxicity. Based on this assessment, appropriate engineering controls, administrative controls, and personal protective equipment, PPE, should be implemented to minimize exposure to the lowest feasible level, aligning with the hierarchy of controls. This approach demonstrates due diligence, a commitment to worker safety, and adherence to the spirit of OSHA regulations. Incorrect approach is analysis. One incorrect approach would be to do nothing because no specific OSHA PEL exists. This fails to recognize the employer's general duty to provide a safe workplace and ignores the potential for harm. It is a direct violation of the OSH Act's fundamental principles. Another incorrect approach would be to arbitrarily set an internal exposure limit without any scientific basis or consultation of recognized toxicological bodies. This lacks the rigor of a proper risk assessment and could result in either inadequate protection or unnecessarily burdensome controls. It fails to demonstrate a good faith effort to protect workers based on sound scientific principles. A third incorrect approach would be to rely solely on anecdotal evidence or worker complaints without conducting a formal risk assessment or seeking expert toxicological advice. While worker feedback is important, it does not substitute for a systematic evaluation of exposure and risk. This approach is reactive rather than proactive and may not adequately address the underlying hazard. Professional reasoning. When faced with a recognized hazard and a lack of specific regulatory limits, a toxicologist must adopt a risk-based approach. This involves 1. Identifying the hazard and potential for exposure. 2. Gathering all relevant scientific information, including toxicity data and any available guidance from reputable organizations. 3. Conducting a comprehensive risk assessment to characterize the likelihood and severity of adverse health effects. 4. Implementing controls according to the hierarchy of controls, elimination, substitution, engineering, administrative PPE. 5. Documenting all steps and decisions. This systematic process ensures that worker protection is prioritized and that actions are based on sound scientific principles and regulatory intent, even in the absence of explicit prescriptive standards. Question 18. Investigation of a novel industrial chemical's toxicological profile reveals several potential adverse effects in animal studies, including liver enzyme elevation, kidney tubule damage, and a statistically significant increase in thyroid follicular cell hyperplasia at the highest dose tested. Which toxicological endpoint, when considered for human health risk assessment, best exemplifies a proactive and protective approach to regulatory decision-making? Option A. Liver enzyme elevation, as it is a common and easily measurable indicator of chemical exposure. Option B. Kidney tubule damage, as it indicates a direct organ toxicity that could have significant health consequences. Option C. Thyroid follicular cell hyperplasia, as it represents a clear biological response to the chemical and is often a precursor to more severe thyroid pathology. Option D. The endpoint with the highest observed effect level, as this suggests a higher threshold for toxicity and thus lower risk. The correct answer is C. Thyroid follicular cell hyperplasia, as it represents a clear biological response to the chemical and is often a precursor to more severe thyroid pathology. Explanation. This scenario presents a professional challenge because a toxicologist must interpret complex data to determine the most sensitive and relevant toxicological endpoint for risk assessment, ensuring public health protection. The challenge lies in selecting an endpoint that accurately reflects potential adverse effects at relevant exposure levels, considering the limitations of available studies and the specific context of the chemical's use. Careful judgment is required to avoid over- or underestimating risk. The correct approach represents best professional practice because it prioritizes the most sensitive and relevant toxicological endpoint for risk assessment, aligning with the principles of robust scientific evaluation and regulatory compliance. This involves a thorough review of all available data, considering dose-response relationships, biological plausibility, and the potential for human health impacts. This approach ensures that regulatory decisions are based on the strongest scientific evidence, leading to appropriate protective measures. An incorrect approach that focuses solely on the most commonly reported endpoint fails to acknowledge that less common but more sensitive endpoints might exist, potentially leading to an underestimation of risk. This is a regulatory failure as it deviates from the principle of using the most protective data available. Another incorrect approach that prioritizes endpoints with the highest observed effect levels overlooks the possibility of adverse effects occurring at lower, more relevant exposure levels. This represents an ethical failure by potentially compromising public health by not adequately considering the full spectrum of potential harm. A further incorrect approach that dismisses endpoints with high variability without a thorough scientific rationale risks ignoring critical information. Variability is inherent in biological systems, and understanding its sources is crucial for robust risk assessment, not a reason for outright dismissal. This constitutes a failure in scientific rigor and professional responsibility. The professional decision-making process for similar situations should involve a systematic evaluation of all available toxicological data, a critical assessment of study quality and relevance, and a clear articulation of the rationale for selecting specific endpoints for risk assessment. Toxicologists must remain objective, prioritize scientific integrity, and adhere to established guidelines and principles of toxicology to ensure accurate and protective risk assessments. Question 19. What factors determine the appropriate methodology for conducting a human health risk assessment for an environmental toxicant under U.S. regulatory frameworks? Option A. The historical use of the toxicant in industrial processes and the ease of obtaining generic toxicity data from international databases. Option B. The perceived public concern regarding the toxicant and the availability of readily accessible, but potentially unvalidated, laboratory studies. Option C. The subjective interpretation of scientific literature by the risk assessor and the cost-effectiveness of the assessment process. Option D. The specific toxicological properties of the substance, the characteristics of the exposed population, and the relevant U.S. regulatory statutes and guidance documents. The correct answer is D. The specific toxicological properties of the substance, the characteristics of the exposed population, and the relevant U.S. regulatory statutes and guidance documents. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a toxicologist to move beyond simply identifying a hazard to quantifying and characterizing the risk it poses to human health within a specific environmental context. The complexity arises from the inherent uncertainties in exposure assessment, dose-response relationships, and the variability of human susceptibility. A toxicologist must integrate scientific data with regulatory requirements to provide a defensible risk assessment that informs public health decisions. Correct approach analysis. The correct approach involves a systematic, science-based process that aligns with U.S. EPA guidelines and principles of risk assessment as applied in the U.S. regulatory framework. This approach prioritizes characterizing potential adverse health effects, hazard identification and dose-response assessment, and then evaluating the likelihood and magnitude of exposure in the relevant population exposure assessment. Finally, it integrates these components to estimate the overall risk characterization. This comprehensive methodology ensures that the assessment is grounded in scientific evidence, addresses regulatory mandates, e.g., under TSCA or CERCLA, and provides a clear, actionable understanding of potential risks to inform risk management decisions. It reflects best professional practice by adhering to established scientific and regulatory standards for risk evaluation. Incorrect approaches analysis. One incorrect approach focuses solely on the inherent toxicity of a substance without considering the likelihood or extent of human exposure. This fails to meet regulatory requirements for risk assessment, which mandate an evaluation of both hazard and exposure. Ethically, it can lead to misallocation of resources by overemphasizing risks that are unlikely to materialize. Another incorrect approach might rely on anecdotal evidence or public perception rather than empirical data and established scientific methodologies. This is a significant regulatory failure, as U.S. environmental regulations are built upon scientific evidence and peer-reviewed data. It also represents an ethical lapse by prioritizing subjective opinions over objective scientific findings, potentially leading to unfounded public alarm or complacency. A third incorrect approach could involve extrapolating data from highly controlled laboratory settings directly to complex real-world environmental scenarios without appropriate consideration for environmental fate, transport, and differing exposure pathways. While laboratory data is crucial, its application in risk assessment requires careful consideration of environmental factors and potential differences in human exposure routes and durations, which is a core component of a robust U.S. risk assessment. Failure to do so can lead to inaccurate risk estimations and flawed regulatory outcomes. Professional reasoning. Professionals should employ a structured risk assessment framework that begins with defining the scope and objectives, followed by hazard identification, dose-response assessment, exposure assessment, and risk characterization. This process should be iterative, incorporating scientific literature, regulatory guidelines, such as those from the U.S. EPA, and expert judgment. Transparency in assumptions and uncertainties is crucial. When faced with novel toxicants or complex exposure scenarios, professionals must critically evaluate available data, identify data gaps, and employ conservative yet scientifically sound approaches to ensure protective public health outcomes while adhering to U.S. regulatory mandates. Question 20. When evaluating a novel pharmaceutical agent with potential life-saving applications for a rare disease, what is the most appropriate course of action for a toxicologist operating under U.S. regulatory frameworks to ensure both patient access and public safety? Option A. Advocate for the drug's immediate approval and widespread use based on promising early-stage in vitro and in vivo animal study results, while acknowledging that human clinical trials will be necessary for long-term monitoring. Option B. Suggest a compassionate use program that allows limited patient access to the drug under strict physician supervision, while simultaneously expediting the submission of incomplete clinical trial data to the FDA for expedited review. Option C. Recommend the drug's approval for marketing and distribution after a thorough review of comprehensive preclinical toxicology studies and robust, multi-phase human clinical trial data demonstrating both safety and efficacy, as required by the FDA. Option D. Advise the pharmaceutical company to prioritize post-market surveillance and real-world evidence collection over extensive pre-approval clinical trials, given the urgent unmet medical need. The correct answer is A. Advocate for the drug's immediate approval and widespread use based on promising early-stage in vitro and in vivo animal study results, while acknowledging that human clinical trials will be necessary for long-term monitoring. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a toxicologist to balance the immediate need for a potentially life-saving medication with the rigorous scientific and regulatory requirements for drug approval in the United States. The pressure to make a drug available quickly can conflict with the imperative to ensure its safety and efficacy through established pathways. The toxicologist must navigate the complexities of the Food and Drug Administration's FDA regulatory framework, which prioritizes public health by demanding robust data before widespread use. Correct approach analysis. The correct approach represents best professional practice because it adheres strictly to the U.S. regulatory framework governing pharmaceuticals, specifically the Federal Food, Drug, and Cosmetic Act, FD&C Act, and associated FDA regulations. This framework mandates that new drugs undergo comprehensive preclinical and clinical testing to demonstrate safety and efficacy before they can be approved for marketing. The toxicologist's role is to interpret and present this data in a manner that meets FDA standards, ensuring that any decision to approve or recommend a drug is based on sound scientific evidence and regulatory compliance. This approach prioritizes patient safety and public trust in the pharmaceutical system. Incorrect approaches analysis. an approach that bypasses or significantly abbreviates the standard preclinical and clinical testing phases, even with promising preliminary data, represents a critical regulatory and ethical failure. This would violate the FD&C Act's requirement for proof of safety and efficacy, potentially exposing the public to unknown risks. Relying solely on anecdotal evidence or the urgency of a medical need without robust scientific validation is ethically unsound and legally non-compliant. Furthermore, advocating for a drug's approval based on incomplete or manipulated data would constitute professional misconduct and undermine the integrity of the regulatory process. Professional reasoning. Professionals in this situation should employ a decision-making framework that prioritizes regulatory compliance and scientific integrity. This involves 1. Thoroughly understanding the relevant U.S. FDA regulations and guidelines for drug development and approval. 2. Critically evaluating all available preclinical and clinical data against these established standards. 3. Identifying any data gaps or areas requiring further investigation. 4. Communicating findings and recommendations clearly and objectively to regulatory bodies and stakeholders, emphasizing adherence to the established approval process. 5. Resisting pressure to compromise scientific rigor or regulatory requirements for expediency.